Thank you for checking out Dr. Christine Greves' website. I'm sitting down with her today to talk about all of your most important questions about the female body. So let's dive right in. Dr. Greves, let's talk about sexually transmitted infections. I'm sure this is something you hear from your patients about a lot. Are there certain STIs that go away after a while, or is this something that you might have for your entire life? Which ones are really serious? Which ones can be treated by antibiotics or other medications? Tell me a little bit about that.
Yes, it's a broad topic, but I'll try to divide it up into sexually transmitted infections that can go away once you treat it, versus those that are there to stay for a very long time, despite your recognizing it and trying to figure out ways of making it better. So let's talk about the ones that once you have it, we can treat it, and then it's gone. Chlamydia is the #1 most common sexually transmitted infection. Why? Well, half the time we can have it and we don't even know we have it. So it's easily passed from one person to another. If you do have a new sexual partner, it's important that you make sure you get tested just in case that could be you, because that can be a very silent infection, can go into your fallopian tubes, which are the little tubes that allow the egg and the sperm to meet to allow you to get pregnant one day. That can scar that, and then it can track up and cause pelvic pain in people. It can increase your risk for a pregnancy outside of your tubes or an ectopic pregnancy. So these are all things that you want to make sure you don't have if you have a new partner, whether you have a discharge or not, if you've had sex, just to make sure you're okay. But let's say you have pain. Let's say you have a vaginal discharge. That should definitely make you aware you could be one of those 50% that do have symptoms. So you'll go in, you'll get evaluated, and then you can be given an antibiotic, and usually it's better. The same holds true for gonorrhea or trichomonas. Those are some infections that we can give you some medicine for. They go away. Hopefully they didn't track up farther in your pelvis and you don't have long-term sequelae from that. So syphilis, in addition to gonorrhea and chlamydia and trichomonas, is another type of infection that you can get where an antibiotic, penicillin, can help treat. Okay, so, but again, it's much better if you catch this early to nip it in the bud. But those are the ones that you can think, okay, I had that, done. And then there are some others, though, that you can get that will stay around in your system. For example, I'm sure you've heard of HPV, human papillomavirus. That now, fortunately, you can get an injection, which is a vaccine, before you become sexually active. You can get it as early as the age of 9, and that can help prevent you from getting certain types of genital warts and also the type of high-risk HPV that can increase your risk for cervical cancer. That is very hard to test a partner for. You can't really test a male partner for unless they tell you they've had a history of genital warts. If they've had a history of genital warts, then they have that virus in their body, and they could share that to you. So that's a very important discussion to have with your sexual partner. Other sexually transmitted infections you could get include herpes. If you have a painful area in the private area, whether it's your labia, your mons, your vagina, rectal area, if it's painful, if they're little blisters, we call them vesicles, then that is something that could increase your awareness for, I may have something and I need to get help. Usually the first outbreak is really painful, and you would need to see your doctor for some help with that. We can give you some medicine for that. It's an antiviral. There are different types, and that can try to help reduce the pain, reduce the amount of time that you have that, but we can't cure it because you'll always have the herpes virus, and if you're stressed, if there are certain things that come up, then that can increase your chance for having an outbreak, and you can therefore share that with your partner, whether a condom is worn or not. There are ways, though, let's say that one person has herpes or had a history of that and the other person doesn't. There are ways at trying to help reduce that transmission to your partner, but that's in another video at another time. Then there are the concerns of HIV. HIV is a virus that you can get with sex. A higher chance of getting it if you don't use a condom, if you have anal sex. And those are, that once you get that, then that doesn't go away. And you need to get some assistance with that, some medication to help control that. Then there's also hepatitis C. And hepatitis C is becoming more and more common. That is hepatitis. It's an infection that goes to your liver, and it can result in ultimate liver failure one day. But these are all really long-term sequelae of getting those blood-transmitted infections. And we are there for you every step of the way. Ways to prevent that, or to try to help prevent or reduce your risk of getting it, is you can use a barrier, but it's not always 100%. Just know that if you do have a sexually transmitted infection, or if you think that you do, make sure you go see your doctor for some further assistance. We're here for you. We're here to hold your hand and help you through that journey.